Right. Again, good afternoon, everyone, and welcome to the Applicant Conference for the Opioid Settlement Fund request for applications for comprehensive outpatient treatment programs. So a little bit in terms of the agenda today, we're just going to do quick introductions and a little bit of housekeeping. And then we will talk a little bit about the RFA, purpose, the goal, what we're trying to achieve here. Give you all some timelines and answer your questions. So feel free to put in your questions in the chat as we go along, and we'll answer those. We'll have time to answer those questions. But if you put them in the chat, definitely we'll get to them. So I'll get started with introductions. I'm Celine Ng. I am a project coordinator with the Opioid Settlement Fund here at OASAS.
Hi, I'm Lucia Perfetti-Clark. I'm the project director for the Opioid Settlement Fund.
Hi, I'm Leslie Poirier, New York State Opioid Treatment Authority, also known as the SOTA, Bureau Director of Adult Treatment Services with OASAS.
Good afternoon, Jason Rubenfeld.
I'm the Deputy Director of Contracts and Procurements.
Jason, you want to go next?
No, Connie, go next and I'll go.
Oh, thanks, Jason. Connie Burke, Associate Commissioner for the Division of Data Management, Research and Planning. Jason.
Right. Thank you. Jason Rubenfeld, Assistant Director of SOTA's Office of Adult Treatment and the SME overseeing this project. Subject matter expert, for those who don't know what SME is.
Sounds good. I'm going to pop the link for the RFA in our chat so everyone has access to it. And then let's get started with talking about the RFA. I'll give it over to Jason.
You're muted, Jason.
I thought this was sign language. Again, good afternoon, everyone. The RFA was released last week. We'll go over some important timelines. We'll go over what exactly is being RFA'd, and then obviously we'll go through any questions that you may have. So for timeline, so it was released on the 8th. The applicant conference, which is today, there'll be a deadline for inquiries, so that will be the 20th, and then we anticipate releasing the questions and answers by February 26th. All applications are due by March 29th, and we anticipate notifications of award going out by April 19th. So in regards to RFA, so this RFA is for comprehensive outpatient programming, what we in the past were calling comprehensive outpatient integrated programs. It is for H22 OTPs, opioid treatment programs, and H22 outpatient programs. So there's 4 different types of comprehensive outpatients that you can RFA for. The first one is if you currently have co-located H22 outpatient and OTP programs in the same location, and you just want to integrate them, or let me change that, merge them together, you could do that under Group A. Under Group B is if you have an existing outpatient program and you would like to add a new OTP. Group C is if you have an OTP and you would like to add and integrate a outpatient program. And then the last group is if you're an existing H22 provider, so either outpatient or OTP, and you want to add a brand new comprehensive outpatient program in a new location. So for instance, using downstate, so if you have a location in Brooklyn as an OTP or outpatient, but then you want to open up in Staten Island, a brand new program with both program types, you could do that under D. And I'm sure we'll have some more questions about Group D as we open the Q&A. But again, it's an existing H22 provider only, and it could be, and it is in a new location for both of those services. Celine, whatever information with that?
Just to cover as well the followings that are not eligible. Jason?
All right, so when looking at whether your program is eligible or ineligible, again, the first part of eligibility is being an H22 provider, either an OTP provider or an outpatient provider. Then we're looking at program types that are not. So if you're a CCBHC, a certified community behavioral health clinic that's New York State funded, you would not be eligible for this RFA. Outpatient rehabs, not regular outpatient programs, outpatient rehabs at this point would not be eligible. Proprietary entities would not be eligible. If you have a H22 outpatient that is on iOS with OMH and under OMH, you would not be able to apply. However, if it is under OASAS, you would be able to apply. And then lastly, if you've already applied for funding under either the first two opioid settlement funds RFAs or the SAPT funding source as well, you would not be eligible to apply for this RFA. When also looking at each of the different group types, each group type has different levels of funding based on what services are being added. So if you go back to Group A, we're allowing up to 4 awards for $374,000 each. Group B is 4 awards for up to $660,000 each. Group C is 4 awards for up to $402,000 each. And Group D, up to 5 awards for up to $760,000 each. So I think it's important to point out you do not have to apply for the full funding if you don't feel that you will need it. However, if you do not apply for the full funding and then later realize you didn't apply for enough, we would not be able to increase that. So for instance, if you apply for Group B but only ask for $200,000, but then realize it costs more to open an OTP, we would not be able to increase that. Celine, anything?
Yeah, I just want to point out real quick in terms of this very last group that is not eligible, that had received funding previously through opioid settlement funds or SAPT funds. This is specifically referring to the specific PRU that received funding. So if you are a provider with multiple PRUs and you received funding under one in any of these previous RFA, but you would like to now apply for funding with your other PRU, maybe in a different location under one of these groups, that is eligible. So it's not at the provider level, it's at the PRU level. And I just want to check in with Nat in terms of what Jason mentioned in terms of requesting for the full amount of the award.
That is 100% accurate. You do not have to request the full amount. You should put in your best estimate. You cannot request more than the maximum amount. But if you request less and then later on expenses come up more, we will not be able to increase your amount. You'd have to find other sources of revenue or methods to do that.
So I put the link in the chat, and on this webpage, you'll be able to find the full RFA if you scroll all the way down to this link and all the attachments that are required in terms of submitting an application. Opening the RFA will bring you to this page, which gives you, again, the timeline that Jason mentioned earlier, as well as all the full details. We can go over some of these details if you have any specific questions, but it is a rather long document, so definitely urge everyone to go in and take a look because it does, specify what items are covered within each group, and you can spend monies on, as well as, how the applications are being graded.
I also want to reiterate something that Celine did say. If you did apply for the RFA in the past and receive funding, and you have a new project you do want to apply for, you can apply for that new project, just not the project that you receive funding for. And at the same time, for this application, if you decide you want to apply for 2 separate projects, that's fine as well. It would have to be at 2 separate locations, though.
Additionally, it would have to be 2 separate applications entirely. So every time you do a PRU, it needs to be a brand new application with all the forms completed. They will be evaluated completely independently. So for example, if you forget a form in one application, but you have it in the other one, unfortunately, that could result in disqualification. We are treating every PRU and every application as unique and distinct. So please make sure that everyone is complete and every location is done as a separate application.
Mm-hmm.
That's very important. Thanks, Ned.
And obviously, when looking at each group that you're going to apply for, that you would want to answer the questions for the specific group that you are applying for. So each of the 4 groups has specific questions and deliverables. So you would have to make sure that, let's say you're applying for an A and C, that each application covers the one that you're actually applying for. So applying for A, answer the questions for A. Applying for C, answer the questions for C. Because there are some differences that would impact your final score if you do not answer the correct questions. Regarding, just want to reiterate, when looking at any of these projects, they do not, so A obviously is currently co-located, but the projects themselves could currently be separate, and then you're bringing them together, which is the goal of the funding, is bring 2 H-22s together under 1 PRU. So if you have an outpatient in one location, but have your OTP in another location and want to bring them together in a new location, you could do that as well. And that would be covered under, and I believe that will be covered under A because they're both currently established programs. So I just wanted to be clear on that the goal is all these services have to end up being in the same location. And for those who've already been through this process for comprehensive outpatient, it's going to be a little bit different than it has been in the past. For especially for those who are applying with this RFA, you will be opening, and Connie, I won't share too much since we don't have much to share yet, but we will be opening up as 1 PRU rather than 2 PRUs. So in essence, it will not be the two programs or PRUs it has been in the past. It will be one physical and administrative program with, one staffing pattern, billing parity, and Connie has her hand up.
I was trying to do a thumbs up and it turned
Oh.
into a wave or me raising my hand instead. So no, it was a thumbs up or a high five. That's a high five, Jason. Read it that way.
Oh, okay. Okay, so I'm gonna stop right there, Celine. If
Yep.
there's other areas you want me to cover, or if there's some questions.
We do have some questions, and I will mention that official answers to all these questions will be posted with our increase in answers response according to the timeline on the RFA. So those are our official responses, but we're happy to take these questions right now, and we'll also include them in the increase in answers after this applicant conference. Before we go into questions, I just want to take a pause and make sure everyone on the panel, if you have anything to add, we can definitely do that right now.
And just overarchingly very happy that our state continues to work on expansion of access to care. So thanks you all for being here, and thank you to our OASAS team.
I just want to reiterate that the answers we're giving here are preliminary. Every question in the chat will be responded in the Q&A, and those will be the official answers. In case there's any discrepancies, the official Q&A holds precedence over any answers we give today.
Thank you, Nat. All right, so let's dive in. So first question, for groups B and C, do the two programs under consideration have to be located at the same site?
So I think that I covered that a little bit a few minutes ago. If you have an existing outpatient or OTP that are not at the same site and you want to bring them together, then, obviously to start, they don't have to, at the end they do. But the goal of this RFA and of this project is to have a H22 program that provides all H22 services, be it dispensing and clinical services, in one location. So yes, ultimately they do have to be in the same location.
All right, moving on. Can we apply for both B and D, as we're interested in adding an OTP at our HQ, which is Group B, but would also like to add an OTP to the OASAS satellite we're applying for, which is Group D?
So for the first question, I could give you a definite yes. For the second question, I would wait for the Q&A, because I think we have to, because in the past the answer would have been no, but with the change for the one PRU, that might make things different. So stay tuned for the Q&A.
And again, to reiterate, if you are one provider and applying for multiple PRUs or multiple different locations, you have to submit applications for every single PRU. The next question, how much of each award is available for renovations or construction? Is the amount different for each group? So the amount is different for each group. Definitely refer to the RFA. It's clearly stated in there. But while we were talking, for Group A, renovations is not to exceed 50,000. For Group B is not to exceed 75,000. Group C is not to exceed 50,000, and Group D is not to exceed 75,000. Do the programs proposing to integrate OTPs and clinics have to be full programs, or one or both of the programs be additional locations, i.e. satellites or medication units, etc.?
So to answer the question, for whatever service is being added through this RFA, they have to be a full service. So we're not providing funding for additional location / medication units in this. But again, we'll get back to you regarding whether you can have a, yeah, would think the answer would be no, because you can't merge an A22 program with a satellite. But so you'll see more in the Q&A, but I don't think that would be allowable.
So within the RFA, under the funding restrictions, we clearly state that integrating with additional locations, medication units, or mobile medication units are not allowable.
Okay.
All right. The next question. Do all OTPs have to do inductions, or would we be able to do only maintenance? If our 822 outpatient is open 5 days and we integrate an OTP, which requires 6 days, does the 6th day need to have all services, or can they be a reduced capacity, i.e. only dosing and not groups?
So I can take a stab at that just at an overarching level. You know, we want folks across the state to be able to have access to care, and so that the Saturday hours, maybe going forward on a regional basis, can be looked at as having you know, modified hours. But we certainly would hope that all of our OTPs get have initiations, a methadone dispensing, and continued care. So I hope that answers things. You know, anything else, it just wouldn't be in line with our 822 operating guidelines.
Anything else to add, Jason? Not.
No, I think Leslie covered it. I do think the first question, I'm not sure was covered. Yes, all OTPs have to do inductions.
Yep. All right. Do providers have to be enrolled in the SFS prior to this application? I think that's you, Nat.
They do not have to be enrolled prior for this application. I believe yes, they do not have to be enrolled prior. That could be part of the application process.
Can funds be used for consultants or to subcontract with a medical provider?
As allowable in each of the 4 categories, I do believe we have that as a allowable cost.
Yep. Again, I would urge you to refer to the RFA for your specific groups and to look at what is allowable under each group. I think this is a clarification to the question before this about additional locations and satellites. So if both programs are satellites, a clinic and a medication unit located at the same site, could they apply to integrate?
Yeah, I think that the way this RFA is written, we wouldn't be able to, because they are medication units and not full A22 programs. However, you know, we may have more information on medication units in the future, but right now, this would not be an allowable expense.
And do you
Right, and
want
then-
to go back to the SFS one real quick?
Sure.
You do not have to be enrolled in SFS prior, but I do want to point something out. SFS pre-qualification is a new process. It used to be that you had to be pre-qualified in Grants Gateway. Now you need to be pre-qualified in SFS at the time of application. So you don't have to be registered in SFS, but you must be pre-qualified in SFS, which may have been the question. In addition, just want to point this out, that the SFS pre-qualification is very similar to the Grants Gateway pre-qualification, but it is slightly different. So please, if you're thinking about applying to this, check your SFS pre-qualification now. And if you're not pre-qualified in SFS, I would get started on it, because it's a new process. The old process used to take 2 or 3 days. The new process should still take 2 or 3 days. I would strongly suggest you start it earlier, just in case you will hit something or snag with the new process. So please keep in mind that pre-qualification Grants Gateway is now pre-qualification SFS. It's very similar, but it is slightly different, and get that started as soon as possible if you're going to apply for anything.
All right. And the next question, again, a clarification question. An 822 satellite location, can an 822 satellite location not have an OTP?
So it can. There's nothing that precludes an 822 satellite from having an OTP medication unit or OTP additional location. It's just that this funding is not tailored to that service. This funding is tailored for H22 specific programs, not H22 additional locations.
All right. I think that's all the questions I have so far. Definitely feel free to add them in as we speak. And I just wanted to also reiterate something on the RFA. If you scroll all the way down to the last page, there is an appendix to the RFA that lists out counties. And just keeping in mind that those are only applicable for applying under groups B and D. They're not applicable for groups A and C. Can funds be used for consultants or to subcontract with a medical provider? I believe we answered that question. The answer is yes. They can be, depending on the group that you are applying under. So refer to the RFA specifically.
So if you could put in the chat, Liz is asking the question, what you mean by subcontract with a medical provider? Because one of the ways that we have seen providers use the funding is to contract with a medical provider who is a consultant to train and educate the medical providers and the clinical staff on OTP programming. So I'm not sure if that's what you mean or if you mean something else. Oh, so subcontract with a medical provider other than somebody in your agency to do the assessments. And so I guess my question would be, would that person be dedicated to your program for however amount of time you subcontract for? I think that would make the difference. Because there's subcontract where you would get somebody new every time you need them, or if there's somebody that you're contracting with that's basically a full-time employee at your agency, but they're subcontracted. I think that would make the difference. Correct, Celine?
Yes, but I also would like to highlight that that could also be in, correct me if I'm wrong, Leslie and Jason, but that could also be something to do with like the regulations of operating a Part 822, either at the state or the federal level. So it's not just about the funding, it's also about the regulations.
Correct.
Yeah, you would absolutely need a medical director who is working for your program. Otherwise, for a person doing assessments, that's something that we can discuss further on if you're awarded the funding, but you do need somebody who's dedicated to the program. If there's extra people, then that would be something we could probably consider, but your medical director can't be a subcontractor.
Right, and that's in your Part 822 operating regulations.
We have another question come through regarding Group A. For each PRU, the outpatient and the OTP must submit separate applications, or if they are co-located and were to apply for the comprehensive outpatient treatment programs. So that is, if you are co-located under Group A, and correct me if I'm wrong, Jason, but if you're in Group A, you're co-located with Part 822 outpatient and an OTP, it is considered as one application, but you have to list both PRUs as the two PRUs that you are going to establish a comprehensive outpatient program.
Correct. So if you're an existing co-located provider, or you're bringing two services in different locations together, you would have to list that both of those services, but that's one application because you're applying to integrate both of those into one. So correct.
Okay. And within your cover page of your application, that information is also being requested. So definitely look very, very carefully within the RFA on what is needed. And like Nat mentioned earlier, every single attachment, just make sure, because that could really just disqualify an application just because you don't have one piece of paper. So definitely check every single item on the RFA and make sure you have every single pieces of information within each document as well. All right, we have another question. Just to clarify, if we have an existing integrated OTP, we can only be able to apply under Group D to develop a new integrated program at another PRU. Is that correct?
So if you are already integrated and that is the only 822 program that you have, then yes, that's correct. But if you have additional outpatient programs, either outpatient or OTPs in different locations that you want to apply for as well, you could apply. So for instance, B, if you have a different OTP that you want to add to outpatient, you could apply for B. If you have for Group C, if you have another outpatient that you want to add, another OTP you want to add an outpatient, you could apply for that. So it really depends. But if you're already integrated and you have no other services, then yes, D is the only one you would be able to apply for.
I don't see any other questions for now. And also to reiterate, if you think of any other questions that come up after this conference, don't worry, you can still ask your question. There is an email address within the RFA for you to submit those questions. So feel free to send in your questions that way. The deadline to submit those questions is February 20th by 5 p.m. EST. So you still have another week or so to submit any questions.
And just to add, something to what Nat said earlier, and just you reminded me, just when you're submitting the application, make sure that you do complete all of the areas. So you're pre-qualified, you submit the narrative, you submit the budget areas. So just review those areas before submitting, so you can make sure that the application is complete. Not seeing any other questions.
Yep. And on that note, whatever Jason just mentioned, with this RFA specifically, there are page limits. So make sure to check that. Anything outside of page limits will not be evaluated. So definitely keep within the rules of the RFA that's stated. Seeing no questions, just going to pause. Does anyone else on the panel have anything else to add before we close out?
No, but thank you, everyone.
All right. Again, definitely send in your questions if you have more, and we will respond with official responses to all these questions in the chat within that timeline that's posted on the RFA. And thank you so much, everyone, for joining. Have a great day.
Thank you, everyone.
Bye-bye.